Hi there, this is Dr. Lawrence King, one of the chiropractors from Corrective Chiropractic in Aylesbury and Milton Keynes, and today we're going to cover two of the main causes of low back pain. So we'll go through a typical presentation with each, and then we'll also go through things that you can do yourself to help ease the symptoms. So to begin with, we'll start with central low back pain. So when we look at the spine from the side here, just to explain the anatomy, the black squares are the vertebrae, the individual bones in the low back. Between these we have a disc, which is represented here by these red lines, and at the back we have two red lines which represent the joints, which predominantly give us movement in flexion and extension. So when we look at back pain in this region of the spine, usually it will present centrally and can spread out onto the side on occasions. It will be worse first thing in the morning, so it may be stiff, uncomfortable, take a number of minutes to get going and warmed up. And also when you cough or sneeze, it can often give a shot of pain or discomfort in that region. So when you have this type of low back pain, a number of things to consider. Please try and make sure you maintain a good curvature in the spine. It certainly takes pressure off the discs and the joints. And walking for long periods of time, up to 30 minutes, will often ease the symptoms. Between walking, you can get a cold compress, some frozen peas, put it in a damp tea towel and apply it to the area of the spine, no more than 10 minutes each hour. The second type of pain that we're going to cover is sacro-iliac joint pain or pelvic pain, commonly referred to as hip pain by a lot of people as well. So now we're looking at the spine from behind, left and right side. On each side we have these big bones at the base of our spine, which are the pelvic bones or ilium, and in between those we have a triangular bone called the sacrum, and those make up on each side, left and right, a sacro-iliac joint. When we look at this type of presentation, the location of the pain will obviously be different. It will be more to the side of the spine on one side or the other, or on some occasions on both. It will be difficult if you sit for a long period of time and go to get up, and also if you walk for a long period of time, that will also create discomfort. So similar to the first example, on this type of presentation we also want to keep a good curvature in the spine. We don't want to sit down for too long, no more than half an hour at a time, and we want to get up and start moving around little and often, so walking up to 15 minutes but no more on a frequent basis. Again, as with the first example, taking a cold compress, frozen peas in a wet tea towel and putting it on the area of the spine for no more than 10 minutes each hour. If you have any questions or comments, please add them below, or if you want any questions answered, you can also send us a private message.